Hello, everybody. I'm very happy to be here with you in the first event and the launching of Nano AI product from Eighteeth. The amazing innovation and the first artificial intelligence tool attached and linked to sensor software. In this presentation, we will talk a lot about this feature. I will try to explain every single details concerning this this amazing tool. Here we have online, we have dentists, we have dealers, we have the company, the mother company, all are watching on Instagram and Facebook. So hello everyone, and allow me to start this presentation. If you are not hearing me anytime or any disconnection occurs, please just type on comments. Okay, what is artificial intelligence and what makes this tool very important? In this presentation, I will try to explain how this tool can be useful in our daily practice and how this tool can increase our revenue and patient acceptance for the treatment. Yes, will increase the revenue and patient acceptance, and I will explain how. Artificial intelligence is based on what we call it machine learning. What is the meaning of machine learning? What makes that? What if I ask you a question? What is the difference between artificial intelligence and, let's say, analyzing software? The analyzing software, or something like having analyzing tool inside it, will analyze based on the information on the input and the output. So you give input, it gives you output like a calculator. But the AI is different between AI, because the AI will always be improved based on the feedback that this AI is getting from you. Okay, so Eighteeth, when they just started to make this tool, they uploaded more than 1 million X-ray on the software or on the artificial intelligence. So the artificial intelligence starting to see all pictures or X-rays, and based on that, the AI will start to learn from one picture to the different picture. For example, why the AI can know that this, for example, for me as a dentist, if you are giving me an upper X-ray, I will not know if it's upper right or upper left. It's maybe impossible to know that in 2D X-ray. So because you can make a mirror reflection, you can flip it, so you can say, no, it's right or left. Okay, we can distinguish between upper and lower, but when it comes to right and left, we have no clue. But artificial intelligence knows that and always will be right. Okay, in this presentation, we will talk about NanoPix AI. We will talk about why NanoPix AI, what is the difference between NanoPix AI and other softwares, because NanoPix AI is not the only existing software on the market, and I will explain you why. The last thing, we will talk about the software surface and the interface. Okay, as you observed on the video before starting this lecture, NanoPix AI is a diagnostic system built into a sensor. Okay, so the difference here, the first difference, that this tool is linked to NanoPix software. So a lot of dentists, when I just posted the post talking about artificial intelligence, they ask, can we take it, can we purchase it and use it in our X-rays on our softwares? I'm asking, do you have NanoPix? If they say yes, we have, I say yes, you can do it. If they say no, we have, for example, any other brand, I say no, because it's only for NanoPix, it's only for Eighteeth. On the market, we have a lot of, maybe not a lot, but more than 5 or 6 softwares that they are analyzing X-rays the same as NanoPix AI, but they are with high monthly subscription fees, and they are not attached to the sensor. So you have to take the X-ray, upload it on the software, waiting the software to giving you the comments and analysis. So this software will give you 4 structures, can identify 4 structures like enamel, dentition, pulp, and tooth outlines, and can give you 10 diseases like fillings, calculus, caries, restorations, bridges, and periapical lesions, and so on. Okay. Artificial intelligence, or NanoPix AI, was improved and came out based on hard work from people, from experts from over than 5 or 6 prestigious universities like Harvard, Peking, and Xinjiang University, and other universities like the Chinese University of Hong Kong. These all experts, they sat together and started to improve this artificial intelligence tool from the scratch. Okay, there's a very nice, let's say, sentence. I like it a lot. That Andres et al., they reported that deep learning, as I mentioned at the beginning of the presentation, it's a machine learning. How much you are learning the machine will give you more and more information. And this is the difference between normal software and artificial intelligence software. So this gentleman says that artificial intelligence can match the diagnosis or the diagnostic performance of 24 oral and maxillofacial surgeons. So one NanoPix, one artificial intelligence can be equal to 24 experts, and this is amazing. Okay, as you can see here, this tool, and I will show you a video in a bit, can identify structures and diseases. For example, here you give the NanoPix AI the X-ray. It takes like 10 seconds, and the software or the AI will analyze this X-ray and giving you this colorful X-ray. So your patient will be amazed. And here we are talking about increasing revenue. Why? I've been using NanoPix AI for more than 3 weeks, and I started to test it on my patients and telling them and asking them that after they accepting my treatment, maybe 40% of them, they said, we accepted your treatment plan because you showed us in a very nice way, in colorful way, our disease. Now I understand what the meaning of short filling. I can understand what the meaning of overfilling. I understand why this tooth needs RCT, because the caries is extended up to the pulp, so this pulp is infected. So I can understand. Our patients, when they are looking at X-ray, for them it's like black and white, right? So let's say we have a lot here of females here. So females, when they are going to gynecologist and making they have baby, and they want to see their babies on the sonar. So the sonar is black and white. So the gynecologist is moving the probe on the tummy and saying, oh, the lung is okay, the circumference of the head is okay, bone is okay, everything is okay. But we are sitting observing. We are not understanding anything. But after that, the gynecologist says, okay, if you pay me more, for example, $40, I will show you your baby in 3 dimensions, and I will show you your baby in colors, and you can hear your baby voice. You say, oh, okay. So for the gynecologist, this is nothing, because he can understand, or she can understand, everything from black and white. But when you are showing this to your patient will be amazed. I have one patient went out from my clinic and came like 2 days later with his sister, I remember, telling me that please use artificial intelligence on her teeth. So they are now, for them, Muhannad is treating patients with artificial intelligence. Okay, so because of that, your patient will be happy. Even your patient will refuse your treatment, your patient will go out with this amazing report that I will show you how to make it, and showing around relatives and other dentists maybe, and influence them by your report. Okay, look, this is a small video. So this is in my laptop, my patient. I'm using artificial intelligence. So here, as you can see, I will stop the video here. Okay, as you can see, it's the normal interface of the NanoPix. It's the normal one. But after you updating this, and the update, please listen to me carefully. This update will be available from tomorrow, from 7th of May. But if you want to use it now, you can connect your distributors to they can send you a link for a sneak trial. Okay, but you can wait till tomorrow, till 7th, and get it from the update. But you will give it for free or for money. I will tell you this at the end of my presentation. So I will not tell you the secret now. Okay, so you will have this small icon. You press this icon, and you will be transferred. You will be transferred to another page, to another interface. Okay, you will see this. 10 seconds. You have these colors, so you can show the patient. Okay, you have implant. So implant is normal, easy. Okay, this is root canal therapy. You have one level. You have filling here. So when you are communicating with your patient will be happy. Your patient will understand what's the meaning of pulp, what's the meaning of caries, what's the meaning of, you see, you can play with the colors, intensity, and colors contrast. Here you can, if maybe someone of you are, I had this question before. So what about the colors? Can I change them? Of course, you can make periapical lesions. And for example, in my interface, I am putting periapical lesions in red color. Okay, so you can change colors as you want. So you can change any color you want to any color, to any other color. So here you see this tool. You can play with the contrast. You see the intelligence here showing you that it's a lower right group, 5, 6, and 7. So for me, okay, it's the lower right because of the position. But if you flip it, it will be left, and you can't identify that at all. For example, for me, I can't know if it's a lower left or right. Okay, unless I'm looking at patient mouth. Okay, I will go to the next slide. Okay, here you press and you can print the, you can save the report for your patient. You can save it on desktop, whatever you want, under patient's name. Okay, and then you can give it to the patient by scanning your QR code or on Bluetooth or WhatsApp or wherever, or AirDrop, however you want to transfer this. And you can see this is the report. It's very amazing one. I have done like this maybe for 10 patients. They are all amazed. They are going around and showing everyone that, oh, look how is my doctor is professional and we're using artificial intelligence. Okay, I will talk now later what is the benefit of that. Okay, as I told you that NanoPix AI will analyze 4 structures: pulp, enamel, dentine, and bone level, and 10 diseases: caries, periapical periodontitis, root canal therapy or root canal fillings, restorations. Restoration means restorations here means veneers or etc. But you will see it as a restoration. Implants, bridges, and NanoPix AI will identify a bridge from crown, and this is amazing. Calculus with shape defect and any notable margins, like defects or open margins. For example, here, if you are showing this to your patient, X-ray to the left, there is no filter, nothing, and you are explaining the patient that you have a caries, this caries is on bone level, maybe submerged, your patient will not understand anything. For our patients, it's only black and white. But after you are coloring this X-ray, our patient will be more, let's say, can understand what you are talking about more and more. And when you are putting the tooth outline, will understand more. And if you have periapical lesion and showing to the patient will understand what that means. And you can compare for your patient healthy teeth to diseased teeth. Okay, for example, here you have periapical lesion. Okay, well, what's the meaning of periapical lesion in any language? When you are showing that periapical lesion, this pink color or red color or blue color, colored by AI. So what I advise you as a 4 weeks this software user, try always to mention it to your patient. You know, maybe 20 years ago or 30 years ago, we started to hear about network, internet, and then we started to hear about nanotechnology. And then now we are talking about artificial intelligence. This tool, okay, now we are just talking about coloring things, coloring periapical lesions, showing canals, root canal filling. Okay, for me as a dentist, I can understand that. I don't need this software, okay? But for your patient, it's very important. And with time and with machine learning, and this is the interesting thing, the most interesting thing. So this service, let's say, this option, it's online option. So if you are a NanoPix user, if you don't have internet, you will not be benefited from this software. So you have to connect your device to the internet. Otherwise, you can't use it. Okay, so it's not offline service, it's online service. Your device must be connected to internet. Why? Because this X-ray will be transferred to a server. The server will analyze it and bring it back to you in 10 seconds. Okay, so with time, NanoPix will have a lot of X-rays. So the experience of the AI will be increased, and in expert developing the group of experts, they will develop this software to read more and more details. And with time, and this is a very interesting thing, the AI will start to talk to you. For example, you have upper 6 here, you have 3 canals, but a 4th canal is suspected. Okay, the AI will start to guide you that, okay, the prevalence of 3 roots or 3 canals in lower 5 or 4. The AI will start to highlight something that you are missing, maybe. Okay, will remind you about that. But this is with time, with updates, with machine learning that I've mentioned at the beginning of my presentation. And here is another video. Okay, it's a lower 7. Okay, this is right or left. Okay, if for example in this position it's lower right, but if I flip it like mirror reflection, it's lower left. But my AI function will read it and give me the correct answer. Here, for example, my patient was convinced to make RCT because what I will show you. This patient has no pain, no complaint, just came to my clinic just for scaling. Okay, and I so there's a very big carious lesion. And I said that you have a caries here. Maybe this caries extended up to the pulp. He said, no, it's a normal tooth. I have no pain. Please, you can proceed and make only the scaling. So I took the X-ray and I told him that, okay, I have a function that will be that will amaze you. He said, okay, show me, please. And I showed him this. And as I told you, in 10 seconds or 15 seconds, you will be transferred to another page. This page okay. So I stopped here and I told my patient, you see the green thing is the caries, the purple thing is a pulp, and you see that the green is already invaded the purple. So your pulp is diseased now. Your pulp must be removed. You have to have root canal therapy. And my patient was convinced, and I have done the root canal therapy. Maybe one of you now will ask me a question. Okay, here in this, before applying these nice colors, I can see the canals, they are continuous up to the end. But artificial intelligence showing me that the canal is short. Okay, as I told you, it's just a communication tool between you and patient. With time, the AI will read more and more. AI can analyze what is presenting and what is available in front of him. Okay, but AI will not analyze something he can't see. Okay, so with time, AI will be trained to be more detailed, to be more precise, to be more accurate, to read and analyze deeper, and maybe to see beyond human abilities. But till this moment, we cannot, or a teeth cannot tell you, or any software existing in the market cannot tell you that this is 100% trustable tool that you can rely on in your diagnosis, definitive diagnosis. No, you as a doctor, definitive diagnosis must be written by you and must be concluded by you as an operator. Okay, so it's a dentist-patient communication tool. So my patient, I can magnify here. So my patient can understand more what the meaning of the pulp, what's the meaning of the caries. And you see in your practice, in your everyday practice, that our dentists, our patients, they can't understand what we are talking about. They have no clue. It's only black and white. Nothing to do with this X-ray. They want something more realistic. As I told you, I gave you a very nice example. As a gynecologist, when gynecologist says that I have a 4D, I have a colorful sonar or colorful ultrasound, it's the same. Here you can see that the AI will tell you this is a bridge, and here telling you this is a crown. Implant, okay, implant is obvious, our patient can understand it, but when you highlight it to your patient, the patient will understand more and more. Here, for example, you have filling. For example, this patient has a pain on biting on this newly, let's say, or recently placed composite filling. And when you are coloring this thing and showing the patient how deep is this filling placed, your patient will be convinced to have vital pulp therapy or endo procedure, or maybe composite changing procedure. So your revenue will be increased. Yes, will be increased. Your patient will value you because you will be a different. Here, for example, your patient suffering from pain on biting and because of the overfilling, let's say, for example. Okay, so easily you can color the putting the AI, and the AI will showing you the root canal filling. It's overextended up to the bone, and you can highlight the tooth outline, and you will convince your patient that this tooth is overfilled. On the other side, you have underfilled tooth, and you can communicate with the patient easily in 2 words only. You have overextended X-ray, or you have underfilling here. Just coloring it to your patient, and your patient will be amazed. Here is the same. When you are putting the filters, and as I told you at the beginning, it's not only a filter. It's machine, let's say, analyzing. The machine here is reading, the machine here is analyzing, the machine will be learned, the machine will be more and more experienced with the time. So, for example, when AI, when you will upload, let's say, 20,000 X-rays to up to the on the NanoPix AI, on Nano AI, NanoPix will be more and more experienced. So NanoPix, it's like a small baby. You can feed him more and more, and this baby will become bigger and bigger and bigger, and the growth will be enhanced and accelerated. Here, for example, you have we are talking here about bone level. When you are putting this small rulers in red line with numbers, your patient will understand that, okay, I'm suffering from bone loss. What's the meaning of bone loss for our patients? It's nothing. Okay, I have bone loss. What I have to do? Give me medication. Give me antibiotic. For our patients, anything can be treated by antibiotics. No, you have this problem, so you have to be referred to your periodontist, for example, or you have to have deep scaling or whatever. Maybe your patient is suffering from diabetes, and your patient is not familiar with that. So when you are giving your patient this, let's say, report, without going, let's say, to Keynote or to any other program, and start to write and to put comment, or maybe on the sensor itself to draw lines using ruler, and then printing a report with your hands. No, you just pressing one button, and you can transfer to patient's iPhone or smartphone, and your patient can take it and show it to the referral doctor. Here you can draw the tooth outline. Here's the same, and this is the report, a nice report. You can edit the report. You can edit the position of the tooth. For example, let's say I told you that AI can know that this tooth is lower right or lower left. Why? Because of the machine learning. But for example, let's say AI will read the left right and the right left, but you see that this is lower left, but AI is giving you that this is a lower right. You can change it. Of course, you can change it. If AI is seeing something that is not there, you can change it. You can remove it, or you can add it. Here you can generate a QR code, and your patient can read it. When you have, let's say, an upper margin, like in this case, your patient will see it in colors, will understand why he or she has to change this crown, or what is the main reason of food impaction, for example. Yes, we all of you will have this icon after upgrading your current version, and you can start to use it. I'm available anytime you want to contact me regarding this tool, asking me. I can tell you I have experience for 1 month, so I can answer any question, hopefully. Eighteeth is open always to any question, to any collaborations, to any opinion. Maybe you have ideas. You can share it with your with Eighteeth or with your distributor. Maybe you are user of other software. You can share this with us, and we can work together to improve that. So this tool will be improved with time, as I told you. So here, as I told you, you can edit, you can remove disease, you can add. Depends on the what you can see or what AI can see. So here, when you are magnifying the X-ray, the patient will start to understand. Okay, so you have a very big lesion. You have here you have a endo-treated tooth. Okay, here on to the left, you can put all comments. You can remove comments. You can remove diseases. You can remove structure. You can remove outline. You can add them. You can add them one by one. It's up to you. You can do whatever you want. You can highlight what you want to show referral doctor, or you can do what you want to show to your patient. You can print out for your patient not only one filter, not only one report. You can print for your patient one report with all comments. You can print for your patient one report with only fillings, or with only preapical lesions, with only root canal treatment, with only pulp, with outlines. So your patient will be well educated in minutes. And here, as I told you, you can change colors. You can change the colors. You can change, sorry, the contrast of the color. You can take screenshots. You can magnify. You can mirror reflect. You can flip horizontal, vertical. This is another very nice one. This is video in my clinic too. AI took the X-ray, inverted, and then flip it. It's upper left. Okay, so so you see I flip it, but the AI will insist that this tooth is upper left. So here I'm magnifying for my patient and showing my patient. You see, you have caries here. You have the pulp is too close to the caries, or the caries is too close to the pulp. So here you have to have filling. Otherwise, in 2 or 3 months, you will come to me and suffering from severe pain. So you will be suffering from irreversible pulpitis. So I will make an RCT for you. But now you can change it only with filling. So the patient will see that this amazing tool helped him, and you saved your patient's money, and you convinced your patient to have his tooth done. Here, magnifying, minimizing, bone level, pulp. I can play with intensity, contrast, caries. All this you can show to your patient. You can put comments. You can remove them. You can write a report. You can add. You can remove. You can do anything you want. The patient will understand what the meaning of enamel, what the meaning of dentine. Where is the enamel border? And where is the dentine and pulp borders, for example, where the pulp is starting and ending. More and more features will come out with nano AI. More and more features, more and more diseases will be tested by and analyzed by this amazing tool. So as I told you that AI demonstrated accuracy, precision, and predictable disease prediction. But when it comes to the let's say to the cost, for example, example, there's a lot of companies. For example, one of the companies based in USA, you have to pay $450 monthly subscription to have this tool. To have this tool, if you are not paying, you will not have it. So you will be disconnected. Okay, but Eighteeth is giving you this tool for how much? Can you comment? We'll give it to you for free. It's a free one. Can you imagine that? It's unimaginable, to be honest. It's for free. When you are starting to be interested, for example, for me, one month ago when they contacted me, and I started to search to see all artificial intelligence tools that analyzing X-rays, they are for money. So you have to send your patient to AI analytic doctor that they use artificial intelligence tools to read X-rays, or you can have it in your clinic, and you have to pay monthly subscription fees. But Eighteeth is doing this for free, so the update will be for free. The no monthly subscription. This function will be available on old and new NanoPix versions. So if you are using a NanoPix for 2 years and you have a old device, you can upgrade it online and have this amazing function. So you don't have to buy a new sensor in order to have this function. So this function is available for all devices, NanoPix 1, NanoPix 2, and NanoPix E or 1.3 for free after update. So yes, it's for free. You can use it from tomorrow. So we have 3 winners. We have 3 winners. Dawood Ali, Al-Ma'mari Amin, wa Akram Dammad. So these doctors were the fastest dentists to answer this question on Eighteeth page. So every one of them will have $300. Eighteeth team will contact you and will set how to deliver this prize to you. And on Instagram, we have this winner. So I don't know the name, but the owner of this account will be contacted by Eighteeth team, and $300 will be gifted to this dentist or to this person. So thank you for watching. I'm open for any question. Now I'm observing Facebook page. I can take some questions from you from Facebook page. So okay, Norma want to ask, please. If you have any question, you can ask, and I can answer it based on my humble knowledge about nano AI. Dr. Hanna Khour is asking how I can send the report using QR code. When it comes to report printing, you will have a function of generating a QR code, and the patient can scan it and have it. How to add the clinic name in the report? I have to check here if we can add it or not, but I think yes, it's something you can add, but the team can help you on this, or your distributor can guide you through this. according to the pocket depth, can we measure it? The AI will measure it alone. Okay. So with the time, as I told you, this is a machine learning. Okay. So with the time, AI will start to talk to you. For example, if the X-ray is not useful, or if the X-ray is not, let's say, clear enough, the AI will ask you to take another X-ray. With the time, AI will tell you, for example, take for me, for example, mesial shift, distal shift. So the AI will start to guide you in order to collect more and more informations to give you a more accurate answer. Whom to contact in Bahrain, I don't know. The Eighteeth medical group will or staff will contact you and tell you. I think Global Med, I think, yes, Global Med in Bahrain. They are the dealer of NanoPix in Bahrain, of Eighteeth in Bahrain. Global. The winners, one more time, I will keep it. The winners. Here are the winners. Here are the winners. Dawood Ali, Al-Ma'mari Amin, wa Akram and Akram Dammad. They are the winners. Questions? Yes, it's a great tool. We have a question here. Highly appreciated. My question is: it only indicate colors on Nano AI features? Tell us how many canal en route and they calcified or not, vertical fracture into. With time, the AI will start to identify vertical root fractures. With time, AI will start to tell you that if the canal is calcified or not. But till this moment, no. If AI is reading the, let's say, the canal, depends on the intensity of the X-ray and the clarity of the X-ray. So if the canals are clear, the artificial intelligence will read them. But artificial intelligence, when you are giving information from 2D X-ray, the AI will not give you an answer like CBCT, because the input is 2D. So AI will not come out with the results of 3D. Okay, so it depends on the input too. So it's okay. It's artificial intelligence, clever, smart, intelligent, but you have to give good material to this person to analyze it for you. So the software can't tell you how many canals. It has to be combined with a 3D image to do that. Okay, so how many canals are blocked? For example, you on the X-ray you see 2 canals, but when you open the tooth under microscope, you found 4 canals or 3 canals. It's not the fault of AI. Okay, so as I told you, it's a patient communication tool, not a definitive diagnostic tool. Yes, this tool should be used with internet. You can't use it offline. Your device must be connected to the internet. Yes, how to I will show you how to upgrade your NanoPix software. You go to tool here. You go to tool. Okay. On tool, you will find the update here. Okay. It will be available from tomorrow, 7th of May. Do we have more questions, or it's a wrap? Daisy, if you are hearing me. We have a question here. What about the privacy? Will the company save the patient history? I think AI will has no access to the patient name and other information, maybe only to the X-ray itself. Will analyze the X-ray regardless the patient is male, female, so privacy will not be a problem, I think. Okay, so thank you. I was very happy to have you all on Facebook, Instagram. My account is available on all social media platforms. You can contact me. Anytime you want, I can answer all your questions. If I have the answer, if I don't have, I can refer you to the distributors or company.